Hello everybody, this is Captain Basile. Today we're going to be going over the iGel and the proper insertion techniques. So the first thing that we need to talk about is they do come in different sizes. They are based off of weight. This is an ideal weight. Kind of a rule of thumb to go by is also by the patient's height. So if you have a patient that is below 5 feet tall, you're going to want to use a size 3 or lower. If you have a patient that is in between about 5 feet to 6 feet tall, go ahead and look at your size 4. And then anybody over 6 feet tall, you'll probably want to consider the size 5. So when we start preparing our patient for the insertion of the iGel, just like any other device, we want to try to get them into that sniffing position as much as possible. It's just going to help the insertion be a little bit smoother. Next thing, once I pick the size that I would like, I'm going to open the package. In our package, we are going to have the securing device. On the back of that, you'll also get to see some lubrication. It's really important that we use this lubrication, so make sure you keep track of it. I'm going to go ahead and take my device out. Again, just check the size. I'm going to make sure that I don't touch the end of this at all. We want to try to maintain as sterile as possible on scene. Keeping the cradle that it comes in, I'm going to go ahead and use the supplied lubrication to place it on this flat part. It is, again, really important that we do take this extra step to make sure it is lubed properly so that we can get a good seated position in our patient. So once I do have the lubrication on the cradle, I'm going to take the end of my device where that cuff is, and I'm going to make sure that the back, the sides, and the front tip of this cuff does get lubricated well. I want to ensure that I do not have any large clumps that may end up blocking the device. Again, everything will stay on the cradle. I'm not using hands, gauze, or anything else to get that lubricated on there. Again, my patient is in the sniffing position. I'm going to open the jaw. There is no need to place any fingers inside the mouth. I'm going to make sure that my cuff is open towards the patient's chin. And when I slide this in, I'm going to make sure that it does run along the top of the mouth or the hard palate. As I go in, I may feel some slight resistance as I first go in. I want to push past that until I feel definite resistance. There's no need to apply extra force. We don't want to be causing any damage, but we do need to make sure that we have it truly in the right position, and so I should feel that true resistance. Also, when I look at the teeth should line up on the bite block or the hard part of the upper part of this device. And there is a black line on here. We want to make sure that the teeth are below that black line. If the teeth happen to be above that black line, we need to change the size of our device to a bigger device. Once I have met definite resistance, I'm going to go ahead and apply my securing strap by sliding it underneath the patient's head. We want to make sure that it is towards the back of the head, not up top. I'm going to apply one side with the holes. When I pull the other side, I do want to make sure that I have a good amount of tension, but I'm not forcing it when I stretch it. I'll apply the other hole, make sure it is in there secure. I'll apply my capnography and then my BVM. At that point, I do want to ensure that I do have capnography. If for whatever reason I do not, I can slightly adjust this tube, pulling it out a few centimeters or side to side to try to get it to seal, and then replace my securing device. After we have good capnography, if we do need to suction, we do need to make sure that the end of our French catheter does get lubricated as well. It's recommended to use a size 12 or smaller. Using my cradling device, the extra lubrication that's still there, I can go ahead and lubricate about an inch of that entire end, as well as where the port is. I can supply a little bit extra lubrication just to the end of that port. Applying the lubrication is going to help make sure that our suction catheter does get all the way down and we're able to suction properly. If you have any questions, please make sure that you contact your on-duty 7-8. We'd be happy to come out and go over these tricks and tips with you. Thank you.